Whee! Once again, we are live. Thank you. Oh, that's kind of odd. I'll have to tell Paul that he's got the wrong one there. Welcome to Chat with the Docs. We are your weekly health and wellness webcast. Is that what this is? A webcast?
Yeah.
Web show. Goofiness.
On-air personalities.
Digital goofiness. You'll notice the recent addition to our studios, the 1953 Buick Skylark.
You gotta hit the antenna.
Have you ever wondered what it would be like if Gomer Pyle would have hosted the Lawrence Welk Show?
I've never wondered.
Oh, 'tis shame.
When was that?
'Tis pity, 'tis true, 'tis true, 'tis pity.
I don't even think I was born yet, was I?
It never happened, but can you imagine the possibilities? Hoopay, 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 wonderful, wonderful. Think of it. Did you? We're in a heat wave. You'll notice I'm wearing my summer clothes. It's a heat wave.
It is 40.
It was 40 degrees today.
Did it get higher than that? I'm gonna look.
When I came to work last Tuesday, it was 15 below. Today, it was 35 above.
It had said 44 for a second. It says 43 now.
That was a 50-degree difference.
I thought I was supposed to get to 41, but now we're already exceeding that.
Heat wave coming.
Mm-hmm.
All that snow, which is piled up taller than my truck, is now melting.
Thank goodness. We need a little bit of a reset.
So, here we is. It's almost the end of February. Next week, it'll actually be March 1st.
Crazy. Because the last 2 months, February, March, I think, are the exact duplicate of each other for how all the days fall. That rarely ever happens, does it?
I think so. We have a flood in our studios here because we're so high-end.
It's probably happening to more
Only
people.
The best. So if you hear water dripping, there's reasons for it.
It's tranquil.
It's
to you guys, not us.
Very zen. This week we have for you the answer to last week's conundrum. We have this week's conundrum. By the way, I have patients that are starting to use the term conundrum. I've got a conundrum for you.
Oh, really?
It's the funniest thing. Which is funny when you consider we only had 8 people watch our last show. And most of them were relatives.
Still people, I guess.
If you want to be part of the show, call us at 608-314-8791. 608-314-8791. It's your chance to pick the brain of a chiropractor and a real live on the ropes acupuncturist.
Yes.
And yes, this is our natural habitat.
Working.
It doesn't end, does it? Let's go straight to the questions.
All right. Want me to read the first one? Ed?
Yeah, let's start with Ed.
Ed in Waukesha, Wisconsin. What do you recommend for treating colds? I'm catching a cold from my grandchildren, and I am afraid that if I go to work with a runny nose and any kind of a cough, they will send me home for 2 weeks, and I can't afford that. I have heard you recommend some things before, but I don't remember which show they're in, so I was hoping you could just say it again. Thanks in advance.
Yeah, that's no problem. We're getting quite the library online. Go back through the shows.
Mm-hmm.
There's plenty of information out there. We'll try to have somebody in the near future go through and catalog some of the questions that we go through.
And I know you were just treating one of our mutual patients for this, and they were amazed how much it helped them, and it was what you said in the last show. between the acupuncture, the liniment oil,
Mhm.
putting the hoodie up, worked like a charm.
It's amazing what happens when you start stimulating Langerhans cells. Ed, first things first, keep the back of your head, upper neck warm. Wear a hood wherever you go. Don't be drinking cold drinks. Keep your body warm. Stay out of the wind. Chinese, there's this ancient Chinese saying, the wind is the bow of 10,000 diseases. It's not naughty for me to talk like that. I have a license.
That's true.
Aren't you jealous?
Yeah, I am. I can't do that.
All you can do is Rice Krispie imitations.
At least I haven't had any patients come in with noodles in their mouth, and
Oh,
I've had some younger
freaky.
ones like think about it though. They're like, "Yeah, I was gonna put some like raw noodle in my mouth and crunch it my teeth when you adjust my neck." And I was like, "Please don't."
Yeah. So Ed, keep everything warm. You can go to the Chinese grocery stores, the Asian grocery stores, and you can. There's a product called white flour oil. That's a word I have a hard time saying.
Well,
Oil.
you say it like you
I
do
can't
in
say it.
Montana. Is
I
that what they
can't
say
say
in
it.
Montana?
I don't know. Some of them do. My sister could never say aluminum or linoleum, and we'd laugh at her. I can't say oil. That's as good as it gets
And-
right there.
Texas tea.
Yeah. One of them cement ponds. Could have put me some catfish and carps in that cement pond. So go to the Asian store, not where you buy little Asian guys to do your taxes or whatever. No, it's a place where you go and you get rice and you get your groceries, Asian themed groceries. Someone's probably going to sue me for that. Write me up and you as some blog. Oh, these guys are naughty. My wife is Asian. I'm not a racist. My sisters are Asian.
I like going to those grocery stores. They usually have a lot of different things than we normally have.
Well, you go in there and you ask for white flour oil. I said it again. White flour oil. And what you do, it's just a little bottle about like yay. And you go and you take and you pour a little bit, just a couple drops on your hand, and you rub it back here on your neck and the top of your shoulders.
Mhm.
Put your hooded sweatshirt on, put it up, and go to bed. That'll probably get you through it. You probably won't be sick in the morning. If you wake up and you're still having trouble, the naturopathic approach would be take a bunch of vitamin C and echinacea and increase your D and start taking zinc. There's better arguments for C and D than there are for zinc. They're saying zinc because of its effect on COVID. Yeah, okay. But we're talking a common cold. There's a difference.
Mm-hmm.
Unfortunately, the testing can't always tell the difference, but there's a difference. So, number one, you should be taking a good dose of vitamin D right now anyway. I would say about 15,000 IU a day for someone who's in pretty good shape. If somebody's waning a little bit, boost that up to 20, 25,000. You need your vitamin D levels up. Herbally, what I like to do, there's a classic Chinese formula called Dispel Invasion. I'm forgetting the pinyin version of it. You can probably find that on Amazon, Dispel Invasion. What I would say is get the tincture form of it and drink maybe half the bottle before you go to bed. When you get up in the morning, take the other half of the bottle. That's a very large dose. But those tinctures are pretty well watered down. You'll be fine. It'll probably burn the cold right out of you and you'll be on your way. The formula that I use, because it's much higher quality, is called Herbal AVR, and it's by Evergreen Herbs. It's It's similar to dispel invasion in that the Chinese would say it dispels wind and dispels the pathogen. It basically, that's Chinese transliteration for it stimulates those Langerhans cells to start making antibodies to kill the viruses. Stimulates your immune system is what it's doing. Herbal AVR is very, very strong. I use it on, if it's a virus, AVR is going to probably get it. If you're symptomatic, I would say start taking 4 to 5 capsules every 3 hours. It's not something you can get online. You have to get it from a practitioner.
Mm-hmm.
So you're in Waukesha,
That's
find
not that
somebody
far.
in that area that carries evergreen herbs, or come in.
Yeah.
It's
really
what,
not that far.
an hour and 15, hour and 20.
Maybe not even. I mean, you can hop on 94 to 26 pretty quick.
Take it from the girl that travels. She gets around.
Yep. Just for work purposes.
She's like the merchant marine, the land-based merchant marine of the Midwest.
How far are you going? I'll tell you how long it takes.
Alvin. Do you remember that?
Chipmunks, yeah.
Oh, I hated the chipmunks. I felt cheated every time I watched them as a kid, which was probably 3 or 4 times. Alvin and Wauwatosa. That's just fun to say. Or let's be hip.
Tosa.
Alvin and Tosa. Alvin and Wauwatosa. I like it better that way. How long should a person be getting treated by an acupuncturist or chiropractor? That's a loaded question. I keep being told to come back twice a week, and it's going on a year. I feel better when I started, but I don't feel great. Number one,
what was your diagnosis?
What was the injury?
Mm-hmm.
Are you doing acupuncture or are you doing chiropractic?
Are you doing both?
Are you doing both? Are you just waving a dead chicken over your head? We don't know. This is why, Alvin, you should call in. 608-314-8791. Carrie's waiting to take your call. Alvin, throw us a bone, man. It could, depending on what's going on, it could take a while.
Mm-hmm.
I'm treating some kidney patients. Kidneys are the deepest organ that we've got in our bodies. It takes a long time to get them to respond. I had a patient who has an injury on her toe, an infection on her toe. I gave her some binders to start helping to pull toxins out of her body, to start cleaning things up as we kill funguses. It's a fungal infection in the toe. Now, number one, if you have an open wound manifesting as if you have a fungal infection manifesting as an open wound, it's systemic in the body. This individual had some serious asthma. After 1 month of treatment with these supplements and herbs, the toe isn't any better per se, but the asthma's gone. Well, it's cleaning things up, and as we continue to clean, it's going to just get deeper and deeper into the body. So depending on what your injury is, it might take a while. Mm-hmm. Depending on what the therapy is.
Yeah. Disc lesions can take a long time.
They can take a long time.
They can take over a year because you're always putting pressure. You always got gravity going against you. Depends what your job is.
If it's plantar fasciitis, you're always on your feet.
Mm-hmm.
It depends on the injury. It depends on so many things. So to try to tie us down and say, how long should it take?
Everybody heals different. What are you doing at home? It's
different for every person. It's different for every injury.
Mm-hmm.
You can have the same person with 2 separate injuries that are going to take longer.
Mm-hmm.
One's going to take longer than the other. So it's a very difficult question to answer, Alvin. I would say if you're concerned that maybe you're getting soaked,
get a second opinion.
Someone might be just, stretching this out. Get a second opinion.
Better talk to the doctor.
Yeah.
And, put it out there. Talk to them. Say, based on what we're doing, what are you thinking? How long do you think?
Let them know you thought you'd be feeling better by now.
Yeah. Have
Where are we at? Because from a practitioner's perspective, you're seeing you know, anywhere from 20 to 50 people in a day as an acupuncturist, it's kind of difficult to keep everybody straight, and you quite frankly don't always look at the chart on a follow-up patient when you're going in. You know what the injury is.
Yeah.
You look at what they're presenting and you treat what's presenting. Oftentimes it's a repeat treatment. Not always, because I treat based on the person's presentation at the moment. Sometimes it's, as a practitioner, you need to be reminded, hey, where are we at? Are you feeling better? Doc, I don't feel like I'm that much better. Well, that you might not feel that way, but remember when you came in, your pain was at a 10 and your pain's at a 3 now.
Yeah.
And when you do go out and you do exert yourself and you do re-injure it a little bit, recovery is less than 12 hours. You wake up in the morning and you're back to a 3. To have that conversation with your practitioner.
Maybe they have an outcome assessment too that they can review, because I know sometimes you'll get that, but then you'll do these outcome assessments and they'll fill them out. Honestly, you kind of say, well, this is when you started. This was maybe 6 weeks into treatment where you were. We'll do another one today. And then you can kind of go down the line of, maybe it's different systems like neck, low back, shoulder. Maybe the shoulder's the last one, but the other 2 got good.
Or maybe they started treating. Let's say they started treating your back, Alvin, and as your back started healing, then your knees started hurting, and then as the knees started healing, now your feet are hurting. So
things are repositioning.
I really don't feel all that better. I still have pain in my body. The back's not hurting anymore, but something's still hurting. I can see how you'd say, I feel like I'm not getting any better. Sometimes you need to communicate with your practitioner to find out exactly where we're at. Am I actually thinking about this? Am I missing something? And sometimes you just need a second opinion. Find a new practitioner to say, hey, could you just check me out? I'm seeing so-and-so. I've been getting treated for this for X amount of time. I just wonder if I'm getting any better. Let someone else assess it. That's a fine thing to do. Build yourself a team of practitioners. Are you ready?
For the conundrum? The answer for the conundrum or a new one?
Coach Fuzzle's dilemma.
I'm ready.
Coach Fuzzle's last week's conundrum. Do you want to read it or do you want me to?
I'll read this when you read the new one. So, all right. Last week's conundrum. Art Carlson was a piano tuner by trade and a glass blower by hobby. He had recently been called to the local high school to tune the piano for the choir. The piano was in the gym where the high school thumb wrestling club was working out. One of the students, while engaged in intense sparring with another student, cried out.
Sparring
with him.
I mean, we're talking.
Cried out in agony. When everyone looked over, the student was holding his wrist and gasping for breath from the pain. Coach Fuzzle went over and examined the student. Unable to tell if the student had sprained or broken the thumb, the coach asked Art for a tool of his trade, received the tool, and then proceeded to check for broken bones. What did Coach Fuzzle ask for?
Number one, that is some intense thumb sparring.
Yeah, that's
if you
pretty
can
good.
Sprain or break a thumb,
that's impressive.
Tough. These kids, they must be incredible hitchhikers.
Can you imagine how beefy that thumb would be?
There you go. So, the answer to last week's conundrum is the poor man's X-ray.
Yes.
I've used it in fact, I used it yesterday. John, if you're watching, hello. It's a tuning fork. It's a tuning fork. What you do is you strike the tuning fork and you check your pitch. You go, and then you strike it again and you put it on
whatever spot
the bone.
Questioning.
Because I'm sounding like my brother. Because the vibrations that are caused by that tuning fork will cause the bone fragments
To irritate and move.
to vibrate. Or if you step on a piece of glass and you're not sure you got it all out,
Yep.
my brother did this. And you take the tuning fork and you put it on there, and then that glass goes, and it starts cutting you up. And then you know, yep, something's in there. I'm going to have to go get it fixed. It was a tuning fork.
Mm-hmm.
Now, once again, we were let down. That's okay. Nobody sent in any answers.
That was a good one too.
That was an underhand.
Mm-hmm.
Tracy from Janesburg, Wisconsin, our humble city. Go ahead.
Okay. My daughter is 15 years old.
You don't have a 15-year-old daughter.
No, I'd have been 15 when I had her, otherwise. My daughter is 15 years old and has very painful periods. She has had to stay home from school for the last couple of years because of the pain. All that she can do is lay in bed with a heating pad. Her pediatrician wants to put her on birth control, but I've read about birth control and hormone therapy makes me worried about it and not want to do it. Is it something that you treat? Yes.
Mm-hmm.
With mine, it connects with the sacrum and all those nerves that innervate it. You can work with the lower back with it. And I know with yours, you can work with the hormones and the blood supply and that.
Yeah. It breaks my heart when I get a kid coming in here, a teenager, and they list on their medications that they're on birth control. And they're coming in because of sports injury. And you say, so you used to have some pretty painful periods, right? Oh, they were the worst. But they're okay now that I'm on birth control. And when did you need to start your thyroid medication? Oh, I just started that this last year. Huh?
Yeah.
And when did you have to start that? It's a downward spiral.
Mm-hmm.
Sometimes you have to do this stuff. But when you have other options.
Exhaust those first before you go for the medication.
Anytime you start chemically playing with hormones, you're putting your finger in that spider web and twisting.
Mm-hmm.
And what happens? The entire spider web gets twisted up.
Because hormones are the messengers.
One hormone affects everything else. If you affect one hormone, it spider webs to every other hormone in the body.
Mm-hmm.
So yeah, in Chinese medicine, when you have painful periods, something like that, we're looking at liver blood stagnation, which causes sharp stabbing pains. We'll probably also have to look at the possibility of some PCOS, maybe some endometriosis, looking at the possibility of some of this stuff. And if so, is it a chronic infection that's causing it? Because these things don't just happen. Is it chronic infection? Is it allergies that are contributing to it? Is it...
Do you think our food is playing in with it?
Yes.
With all the dairy that gets treated with hormone?
Exactly. Do you remember when 12-year-old girls still were built like kids?
Yeah.
That's not the case anymore.
No. They're more developed than I am sometimes.
Our food is so full of hormones. And these people are giving it to their kids because, we're told we're lousy parents if you don't give your kid milk.
Isn't it crazy, though, like how tall some of these kids are now? The ones that are maybe 18, 21
Well, that's because
years old.
Sasquatch has gotten into our gene pool.
Oh, yeah? Well, even ones that were my age in high school, there weren't too many that were much past 6 foot. I mean, a few of them, and now you got ones that they're well over 6'5".
You had a midget class.
Did I? I only had 88 in mine, so there wasn't a lot of pickings.
I had 7 in my class. 2 of the guys were over 6 foot.
Really?
The other
Public
two of
school?
us, were, I think I was 5'10", Keith was 5'9".
That's what you had in public school in your class.
I was in a private school.
Okay.
I started out in a public school. I started out at Janesville Craig.
Okay.
And there were more people in that school than in the town that I'd come from in Montana.
Yep.
And I couldn't handle it. It was just driving. I felt like a cow in a feedlot when I'd go to change classes.
Yep.
And people were getting less than thrilled when I'd be walking through carrying my bags going, "Argh!" And beware the Oscar Mayer truck. No one had a sense of humor. I saw my first person with purple hair and safety pins in his cheeks there. It was unique.
That is unique.
So my parents, thank God, put me into a tiny little school in Beloit where there were 7 of us in the graduating class. And
It worked out well. Good.
But, 2 of the guys were over 6 foot or over.
That's crazy. So I don't know. It just seemed like it jumped to the next generation. My brother's 8 years younger than I am. And more of them seem that they are taller.
Yeah. It kind of does that, though, in history. It kind of ebbs and flows.
I suppose. With
And
the
you look
genes, how it switches through.
You look at the guys during the Civil War. Most
they
of
weren't
them were
very
tiny.
big. Mm-hmm.
Most of them were tiny. Charlemagne the Great. Don't be little 5'2". So, Tracy, can we treat it? Yes, we treat that sort of thing all the time.
Mm-hmm.
You want to move the blood. You want to reduce the stagnation in the body.
Inflammation, all of it.
You want to increase blood flow through the liver. What happens when you do that? Then your body can dump what it's trying to dump, get rid of that infection, and now you have a chance to heal.
And look at what the diet is, too. If you're eating a lot of inflammatory foods, it's going to show.
Yeah. What are some inflammatory foods?
Pastas, breads, sugar, processed meats, corn. Anything that tastes good that you snack on, for the most part.
Jerky?
Not real food.
Jerky?
Depends how you make it. I know yours is probably good because you make it yourself.
It's really good.
I was going to say yours is good quality, but like the stuff that has that preservative pack in it, not so much.
If your jerky has more than, say, 3 to 5 ingredients in it, it's garbage. If your snackage has more than 3 to 5 ingredients in it, you probably shouldn't be eating it.
Mm.
Anything processed is not anything processed. I can't say it. Processed and all. Anything processed is going to have inflammation in the body. So try to limit that things. The first 3 things that a naturopath would say is cut out dairy, cut out eggs, cut out grains.
Mm-hmm.
Start there and go to an organic diet. Why organic? 3 years ago, my patients would ask me, Modi, what do you think about organic? And I'd say, I think it's one of the biggest hoaxes going. And by and large, it is. Except you can't be considered organic and still have a certain level of glyphosate in the product.
Mm-hmm.
We've talked at length on previous shows about glyphosates and what they do. They'll mess everything up. So from that standpoint, that you're getting the glyphosate out of your diet, yeah, eat organic. So Tracy, watch the diet. Get her in so Dr. Noel and myself can see her. Dr. Noel can be working on pelvic alignment and innervation. Mm-hmm. I can be working on blood flow. I can be working on balancing hormones. How's her mood? Is she very irritable? Is she tired all the time? Is she very cold extremities? Mm-hmm. Does she walk around in the winter in shorts and then, her belly exposed? For a while, that was in fashion. And you had all these girls getting...
It's coming back in again.
Cold.
You see the crop tops.
Yeah. You get all these teenage girls getting cold strikes on their ovaries and their bellies. And from a Chinese pattern, it's because you're exposing your belly to cold. Cold causes things to stop moving. What do molecules do? The colder they get, they slow down until you get to Kelvin, 0 Kelvin, and then there's no molecular movement. Temperature is just a measure of molecular movement. So
We
keep
can work
her
with it.
keep her warm, bring her in ASAP so we can get this poor kid some relief. Usually by the time next month rolls around, Menses will be totally different.
Mhm.
Totally different. In fact, we just had, in the acupuncture side of the clinic, we just had a patient like this. Used to have severe migraines with menses, severe cramping. Last month was her first. She'd had three weeks of treatment acupuncture-wise. Didn't even get into herbs yet, because with that, usually I'll wait on herbs. Didn't get into herbs, just acupuncture. 3 weeks of treatment. Started menses. Had a slight headache, but it wasn't anything to write home about. No real cramping. She was fine.
That's awesome. Major
That's
improvement.
life changing.
Mm-hmm.
So, can we work with it? Absolutely.
Mm-hmm.
Are you ready?
For the conundrum. Always ready.
Okay, this week's conundrum. Earl Clavin, there's a good man, had the finest cubicle in the office building. He vacuumed the fabric walls daily with his vintage dustbuster. We know this guy's, he's a collector. He's high class. He polished the thumbtacks holding up his very own motivational poster of a kitten hanging onto a branch with the words, "Hang in there," emblazoned across the bottom. His bobblehead doll next to his telephone was cleaned and oiled monthly. He was the ideal distance to the water cooler and the copy machine. Close enough to be convenient, yet far enough away not to have to listen to the idle chit-chat or endure the smell of the copy toner. His world was perfect, if not a little weird, and he was the envy of the other cubicle rats.
Gosh.
Aren't you glad you don't work in a cubicle?
Yeah, I'm glad now.
Wow. But one day his world changed. Dun, dun, dun.
No.
It was announced that the HVAC in the building would have to be rerouted and a vent would be placed directly above his cubicle.
That's not good.
The excitement of change was almost too much. Earl lay awake at night contemplating if the increased airflow would be a boon or a detractor to his prime real estate. Is this nuts? After 2 weeks of the building air conditioner blowing down onto the side of his face, he had decided he had to move cubicles. The cold air blowing on his face was just too much. He could feel numbness and tingling beginning on the left side of his face. His world was in turmoil, but it was too late. As he walked into the HR office to procure the cubicle move request forms, the HR manager looked up at him, gasped, and called an ambulance. What did the HR manager see to cause her to panic and call the ambulance? Woo! How's that for a conundrum?
That's a crazy one.
Wow! If you think you know the answer, just call us.
Yeah, just call. We don't make it hard.
608-314-8791. Tell Carrie your name, number, leave a voicemail if it's after hours, and just tell us what the answer is. Or email us at info@silomcenter.com if you want to get bonus points. Then you can put it
On something.
on something cool and send it to us. And at this point, you'll see it's broad spectrum. Anything that's cool.
Mm-hmm.
You know, a life-size color cutout of Regis Philbin. That'd be kind of fun.
You put them right there.
Why behind me? Let him lurk behind you.
Okay.
He's kind of short. He probably couldn't see over you.
That'd be funny.
Little Regis looking up
Right.
on Dr. Noel. Dr. Noel, do you feel like someone is keeping an eye on you?
Just Regis.
Okay. So, Aaron in Rockford.
Me to read it?
Sure.
The skin on the sides of my fingers peel a lot. Stress makes it worse and seems like if I eat certain foods, this can make it worse. They hurt and bleed a lot.
Oh, is this cool? Any ideas? without
would-
being able to put your hands on this person and assess them.
Mhm.
That
I would say like either a gluten allergy or a mold allergy, fungal.
agreed. Aaron, you mentioned that certain foods make it worse, stress makes it worse. Number one, there's food sensitivities and allergies involved. And likely it's a gluten thing because gluten allergy will often present that way. Number two, there's probably mold in them thar hills. And the mold spores that get into the air, the mycotoxins that they give off and we breathe in, the gases and everything else, can cause an autoimmune response in our body, which can show up at the Jing well points on the body, because that's what these are on the sides of the fingernails, which show up as heat bursting through the skin at the Jing well point, which Chinese medicine, you think of it and you go, wow, that's fascinating. The inflammation is literally bursting through the skin and starting that peeling and bleeding, and it's painful, and it puts you at risk of infection. So what would you do from a chiropractic perspective besides limit diet?
Well, there's definitely inflammation too. I would be adjusting that and just keeping an eye on it. I've already seen this in patients where they actually get a cyst, like kind of in by those cuticles and that, and you monitor it as they're going through, see if they are following through the dietary changes. If they're not, and it keeps getting worse, and they've already done the dietary changes, trying to get the inflammation down, sometimes I refer it into a naturopath or something like that. Sometimes you gotta get blood work done. So make sure it's nothing else, not other infections going on, like staph or anything like that.
What I would do is I would start the individual on an NAET protocol. Start identifying and clearing allergies. Check it, see if there's any bacterial response, see if it's a fungal response.
The ones that I've seen it, they also have RA.
Really? What do we know about RA?
Inflammation that jumps around.
Chronic infection. Lyme disease, often. Often there's a Lyme factor with RA.
I could see that, especially when it starts really young.
Yeah, there's
Because I had one that started while they were still in high school with RA.
rheumatoid arthritis is an autoimmune issue. What do we know about that? Something turns the gene on. It doesn't have to be expressed. So if it's a fungal issue and you're living in a house or you're working in an office that might have some mold issues, that's when you're going to need to start taking some binders that will bond to those toxins that are in your body that are causing inflammation.
Get them out.
Start getting them out. Change diet. Clear allergies and sensitivities. Get the liver draining better, because if the liver and the kidneys aren't draining, all that stuff has to come somewhere, and so it goes out through the skin. Excuse me. Calvin in St. Louis, Mo. Can you read it?
Sure. My back hurts severely. I work at a truck stop changing truck tires. I do all right for a while, and then if there is any stress or anxiety, my back goes out and I can hardly move or breathe. I quit drinking because I noticed that beer made my back hurt, as stupid as that sounds. I can go and get an adjustment. Most of the time it's okay, but if there is stress from a phone call or something like that while I'm leaving, or if there's any kind of stress with scheduling, it can start hurting before I even get to the car. Well, it all connects, especially if your muscles start gripping down on each other and irritate that disc, which fires the nerve, and it's a vicious cycle.
I would ask, what levels are they treating?
And it could go with the adrenals too. The adrenals sit on top of the kidneys, and that's also lower back.
Mhm. Most likely, it's a psoas thing.
That's pulling you in.
And the reason it responds so quickly to emotional strain is because, again, the liver vessel goes right down through that psoas muscle. And so if there is, the liver is the seat of the emotions in Chinese medicine. So if there is an emotional or any kind of psychological shock or stress, the liver goes, and that whole vascular network that's associated with the liver does the exact same thing, and that psoas gets jerked and it pulls you. And that, what is it? Where's the origin point on the psoas?
Well, it hooks into the upper lumbar, and then it hooks in down by the femur. So
Yeah.
it crosses. So sometimes when you have lower back pain, but you really can't hit it from the outside, it's internal that it's pulling.
Right. And so if it's L1, 2, 3 area, what else is connecting there? Diaphragm, right? So therefore, you're trying to breathe and your breath is real tight because your diaphragm's not able to move. It's kind of spastic because the neural connection into the spine is interrupted. So if it's in that upper lumbar region that they're treating, I would say have them take a look at the psoas.
Do some release.
See a good body mechanics technician. Okay? You are a very good body mechanic technician. We've mentioned him before. Dr. Luke Lago over in Milwaukee is a very good body mechanic technician. Not very many practitioners are. These are people that know the various releases. And I know you are because I've seen you do it on me. I've seen you do it on countless patients now, where you're not doing just the standard cookbook adjustment. You're going in and you're doing muscle manipulations, soft tissue manipulations to get the hard tissue to do what you need it to do. Now, you want somebody that knows how to do a good psoas release without... There's a couple ways of going at it. One, just kind of pressing down through the abdominal wall and trying to... That's miserable. And if it's going on the right side, you do run the risk of rupturing the appendix by doing that. It's not something I would recommend. But there's other ways to do it.
I like to feed more into the bony tissue where it connects in with that bony tissue, the iliacus, and going down into the hip and moving the hip, where you're getting some passive motion that I'm putting them through while doing it. Sometimes I'll do active motion too to try to do neuromuscular re-education, the tissue.
Yeah. So Calvin, have whoever you're working with, have them take a look at your psoas and how that's all connecting. Get into somebody that can work with you on working on your liver vessel from a Chinese perspective. Probably going to need some Jiawei Shiao-san just to try to help move that liver and clear some of the heat out. There's a formula from Evergreen Herbs, Calm ES, which works great on the liver heart, but it also has herbs in it that are antispasmodic. So now you have antispasmodic herbs working on the liver vessel. It's probably just what you needed.
And you might even want to go over some ergonomics with your practitioner if you're moving those truck tires, because you're probably using the hip flexors to try to move some of those bigger tires, because it's for
that's a hard job.
Semi-trailers, yeah.
That's a hard job. You put your body through a lot with that. So I think that's why stress can make you hurt by the time you walk out to the car. B, the breath. Oh, and as far as the alcohol goes, what does alcohol affect? Liver. There you go, man.
Alcohol's not as fun. The older you get.
Tastes like cough medicine. I'm not a big fan.
Yeah, I don't know. It just the older you get, the worse you handle it.
When I was a boy, I used to have some pretty serious bronchial stuff, and my parents found a cough medicine at the local hippie grocery store in Helena, Montana. This is when I was a toddler, and it was clear liquid that kind of shimmered in there, and it had a donkey looking at you like this and kicking
Okay.
on the label. And I think it was probably just someone's moonshine.
Could have been.
But now when I drink, if I'm going to try to be cool and drink something with some friends, that's what it reminds me of. And it's just not worth drinking. I'm not cool. Hannah and Abilene.
I get more uncool as the years go by.
Yeah.
How's Hannah doing though? We'll get her in, and then we'll be.
We've got 4
1
minutes.
hour. Okay. Should I read it?
Sure.
We just moved to Abilene a year ago, and last spring my allergies were horrible. We are starting spring very soon, and I know it's going to be a bad one again. Is there something I can do to minimize my allergies?
First off, Hannah, my family, we've been praying for you all down there in Texas. My goodness. I hope you and your family are safe. I hope you and your family are safe, and I hope that you guys make it through all of this. Yes, the flowers in Texas, the springs in Texas are intense. With the flowers, the weeds, and everything coming to life, the budding of the trees. So, number one, you should see somebody that does an AET.
Mm-hmm.
Probably, if you don't have anyone in Abilene, I'd say Dallas, Fort Worth, there's definitely going to be somebody there. An AET can get your body desensitized to all of these pollens so that you don't have that reaction.
And sometimes that even works better before you hit that allergy season.
That's absolutely right.
That's what you did with me.
Secondly, there's a product called Natural Dehist by Orthomolecular.
Mm-hmm. Yep.
That's a very powerful tool. You wake up in the morning and your nose is this thing, and you're going, wow. Start popping one Dehist every 15 minutes until the symptoms clear. Sometimes
helps clear the liver out, right?
It does. It does, and it calms those mast cells in the sinuses. Sometimes if I wake up with a sinus headache because of a weather change, I'll just start popping some Dehist, nettles, and some other herbs. Mm-hmm. The other thing is start eating some raw bee pollen from your area. Mm-hmm. You guys have some pretty neat beekeepers down in that area.
What's the shelf life for those bee pollens that you can get?
If it's refrigerated, technically they're saying a year, but it's rather indefinite. As long as it's not molding, it's still good.
Okay.
It might dry out a little bit, but it's fine.
Cool.
So Hannah, there's definitely some hope for your allergies. Don't let it get you down. Don't get you down. Once again, you've wasted a perfectly good hour with us. All three of you did. Thank you.
For the chat with the Doc's lunch hour.
That's right. For those of you that will be watching this later, thank you for tuning in. Make sure you, what do they say? Hit the subscribe button and hit the like button. And share. Not share as in very tall, skinny woman with creepy long hair that moans and groans into a microphone. Not that share. Like and share, subscribe.
Yeah.
Hit the little bell dingy. I don't think anyone. More cowbell. And until next week, shalom and be well.
Bye, guys.